Everyone, it's Winning Wednesday, and your girl is back from the motherland. I am so happy to be back in the United States of America, the greatest nation. Can I talk about my nation? The United States of America, the land of the free and the home of the brave. I am live from US of A, and I'm so happy. What the reason why I'm so happy too is that the team did something super special for you guys, because while I was away in Kenya, I was getting the messages, hey, when are you coming back? When are you coming here? When is the next V2 sale? So we are doing the welcome home sale on the V2. I don't know if you've seen it, but you got to check it out. So remember, with the V2 now, and this is actually, they're doing 3 months for the price of one welcome home sale. And also you can get started for as low as $69. So this is kind of actually a pre-Black Friday sale that is going on just for a short amount of time, like just days. How many days are we doing this for? Just this week. Okay. So Friday, it'll be down. So we're talking about getting into the V2. Yes, right now, V2, you're going to get the platform where you'll watch your videos here. My lecture is very important. You also have the Q Bank in the V2 as well. And then what makes Remar different? The books. Okay. So you're going to get books plus the platform welcome home sale. And listen, I am so happy to be home. I came home to some things. First of all, let me just say though, one thing that I brought back from Kenya was the tea. This, when you get a cup of Kenyan tea, African tea, it will change your life. So I'm going to be missing that. But y'all, the first thing my American self did when I got back home, and I flew actually into New York. How do you know you're back in the US? When the majority become the minority. So I knew I had left Africa when I got back to the US, and I was just immersed in diversity. I was immersed in diversity. So I flew into JFK, and then I settled into Pittsburgh. Now I'm back in Ohio. So the first thing I did, girl got her some DoorDash. I'm big backing. So DoorDash hotheads over Chipotle. Okay. Got my Coke Zero because I didn't have any of that there. And then I came home to mail, tons of mail. Y'all know how that go. And I see that we are doing this here in the US. Okay. Very rarely did I see Christmas stuff over in Kenya in the stores, but my goodness, it's like here in the US, the holidays are back in full swing. I was sad though when I had to leave behind this. If you ever going to go to Africa, any part, especially Kenya, you will have to get a universal adapter. So I will no longer be needing this because they're, we do a 2-prong system here in the US. They have a 3-prong. So I had to carry this literally everywhere with me. So I will be putting this away as I settle into my American life. And Pampers, USA Pampers. I got some of this for the baby because the diapers in Africa, if you know, you know, they're just different. So I am in my amazing country, and this is the back home welcome home sale. So I want to see my students really getting into the V2 this week only. This week only, you can get started in my V2 for $69. So that is the happening we are going to be talking about on this particular Winning Wednesday episode. Shout out to you guys who are joining me live. Peptic ulcer disease. Pow! Peptic ulcer disease. It is something that is a very common occurrence in the patient population here in the United States, here in Canada, here in Australia. Those are the issues that you need to be talking about for healthcare. And this is very important if you're going to be a nurse in the USA. If you're going to be a nurse in the US, you have to know about our disease processes here. So peptic ulcers, why does this happen? What is it? If somebody asked you to describe peptic ulcer disease, what would you say that your patient has a problem with? Liberia is in the house. Liberia is in the house. Amazing. Where else is everybody from tonight? Let me know. It's 9 p.m. here in Ohio, the West Coast, but it feels so much later. My body is on a whole different time zone. Whew. So, peptic ulcer disease, how I want you to understand it, it says it's in Quick Facts, page 75. Let's go there. Quick Facts, page 75. That's pressure ulcers. Close. All right, we're going to go page 68. My book is page 68. Quick Facts, peptic ulcer disease. Okay, this is what we're talking about. Yes, so essentially it's ulcerations or lesions. Okay, this is a situation of lesions, and there are many causes. H. pylori is a cause for this. So I'm not sure where everybody is telling me that, oh, Saudi Arabia, Canada, New Hampshire, Puerto Rico, in St. Croix, though. Okay, so when we're talking about peptic ulcers, we're talking about lesions that are in places they're not supposed to be. So we need to know where those lesions are and why they are occurring. Also, what are the clinical symptoms our patient has? So let's just get into peptic ulcer disease. So this happens when there's a sore or an open wound in the lining of the stomach. And see, watch me, I'm making this so simple. I'm trying to make this so simple. So there's an open wound in the lining of the stomach or the first part of the small intestine. So that's where you can have your gastric ulcers or your duodenal ulcers. Okay. And so, so the first part of the small intestine is called the duodenum. Remember, this occurs because the protective layer is weakened, allowing stomach acid and digestive enzymes to damage the tissue. Okay. Now I do want to point out something, because in Quick Facts on page 68, we discuss mainly gastric ulcers and duodenal ulcers here, and you do want to have this chart memorized. However, I did see the Remar nurse, Rena, also put esophageal ulcers, which can happen too in the esophagus or the esophagus. So those are the 3 locations that you can have a gastric ulcer. But for NCLEX, a peptic ulcer. So for NCLEX, the gastric and the duodenal ulcers are going to be the ones that are going to be highlighted. Those 2. Okay, let's go back to this slide and let's continue reading before we get into our practice questions. Shout out to Baby. Please say the baby. And Gracia. Hi, Professor Regina and Pastor Mark. I passed NCLEX after retiring. Okay, after retiring on my 5th attempt. On the 5th attempt, well, that certainly is amazing. And what I'll say is that with this next generation NCLEX, people who traditionally did not have success with the last iteration of NCLEX are experiencing success. So if you are a repeat test taker and you're trying to decide, do I want to do this? Do I want to put myself out there? Do I want to pay all the money? I would say yes. I would say today is the day that you say yes to yourself instead of no, because we are seeing success like this. We are seeing success where students did not have it previously. Okay. And I am never concerned about how many times you have failed the NCLEX, because sometimes we get in a pattern of just doing the same bad thing over and over again. And so that can happen with NCLEX too. You're human, right? You just go in trying your best and not really taking time to process, where did I go wrong? So there's a couple places the students go wrong. I like to talk about it a little bit later on after this lesson. So congratulations to you. Congratulations. So there's peptic ulcers. Of course, you want to know gastric, duodenal, and stress ulcers as well. And basically, those are going to present in various locations throughout the GI tract. The pathogenesis or etiology, why does this thing happen? we saw in the comments H. pylori. Oh, what a nasty, nasty infection. It can cause breakdown of that gastric lining. Medications such as NSAIDs, corticosteroids, and aspirins, we know that these also can cause GI bleeding, can cause our patient to have some gastric distress. So we always tell patients, if you're taking ibuprofen, you have to monitor for what, right? It can cause some GI bleeding. Risk factors include lifestyle. So of course, patients that smoke or drink alcohol, you're going to open your body up to not be as strong as it should be. And your immune system and issues with inflammation are going to present themselves strong because you are putting poison constantly in your body, and your body has to deal with not only the poison that you're ingesting, but also natural things that begin to attack a weakened body. So education, health education, even if it feels like we're telling the patients the same thing over and over again: don't drink, don't smoke, don't drink, don't smoke. But it may be one day that you say it, that they say, I understand. Okay. So I tell my kids, you'll hear me now, but you'll understand me later. And it's the same principle we have to say to our patients. I'm not going to give up on you. I'm going to keep telling you what you need to know to make a great decision for yourself. So, medications can also cause, like I said, medications can cause it. Risk factors are lifestyle, the pathophysiologic stress. How is it that physical stress can cause a peptic ulcer? Somebody make it clear to me. How does this happen? A patient can say, I lost my job 3 months ago, and now I have ulcers in my stomach. Now I have a gastric ulcer. How does that happen? Did anybody think that? Oh my goodness. What is the connection between physical stress and peptic ulcers? I'm looking for it in my comments. Passed my NCLEX in 2023, but I keep coming back here on a regular basis. You are my brain refresher in CEU. I love it. I love it because that speaks to a relationship. You and I have done something that is very rare in nursing education. We have developed a great relationship where you know where to find me and I know where to find you too. And that's not easy to do. Mona Oto says, I passed my NCLEX PN. Shout out to the practical nurses holding it down on last Monday using quick facts in V2 only. Thank you, Miss Regina. God bless you so much. Remar forever. Wow. Do you know it was one point that they wanted to displace, get rid of, phase out practical nurses? Do you know that that was the mentality, which is probably why we're in such a horrible state right now? But there was a time when practical nurses were not valued. And if you were a registered nurse, you can find a job. But if you were a practical nurse, hospitals would be like, we don't know how long you're going to be around. Can you imagine? And then so what happened is, bam, nursing shortage that we're still trying to recover from. So I love practical nurses. When I see them, I commend them. If you know, some practical nurses will outwork a registered nurse, outwork a master's prepared nurses because they have the skills. Okay, so I asked the question, what is the link between physiological stress and gastric ulcers? How is that? So I see some really great answers. Physical stress can cause the release of more hydrochloric acid to cause autodigestion. Okay, the stress produces an oversecretion of hydrochloric acid in the stomach. Okay, also stress due to lack of appetite. All right, and what else? Other good questions. Loss of Steroids, no shortage. They need to pay more. Ah, oh, there's a shortage of jobs for sure. Maybe some cities have more than others. Physiologic stress can cause peptic ulcers because when stressed, an individual doesn't eat, leading to breakage in the stomach lining. Okay. So this is part of your assignment, is that when you're studying for NCLEX, it's not a test of memorization. It is a test of understanding. So if somebody asks you that question, that is absolutely a minimum competency question if you have studied peptic ulcers or gastric ulcers. All right. So how do we diagnose? How do we investigate what our patient may be reporting? Well, we do have to do a gastrointestinal workup. This is where the diagnostic exams become so important. Endoscopy, gastric biopsy. I expect you to know the term biopsy. I expect you to already know the term endoscopy because we're graduate nurses here. I expect you to be familiar with H. pylori, the stool study, okay? And then breath tests. Breath tests are so important. Stool study tests are so important. What are we looking for in those two instances? What makes a stool test unique? Okay. Blood workup, CBC, a complete blood count, or CMP, a complete metabolic panel. As a nurse that is preparing for a licensure examination, you should absolutely know if a doctor orders a CMP, what are they looking for? What will you be looking for? And I'll be honest with you, I did not know when I graduated from nursing school. I did not understand the difference. Okay. The CBC and the CMP, those were just terms that I heard the real nurses use. And I did not understand the difference between the two. So I want you to be able to understand and anticipate the difference between a CBC and a CMP. If you know it, put it in the comments. It's just something real quick. Put it in the comments and then I'll read it for everybody. This is what studying should look like. This is what studying should feel like. It is not about doing 100 practice questions. Y'all stay out of them question banks until you've done this work first. This work is unique. Okay. All right. And so how we talked about what it is, how we investigate it, how we diagnose it, how do we treat it? We're going to do either acid suppression, because we did say that when a person is under stress, they may have an increase of the increase in hydrochloric acid. Okay. So we want to decrease that production. So you give anti-secretory therapies, proton pump inhibitors, H2 blockers, and antacids that will help that the acid is not eating up the stomach lining. So a complete blood count and a metabolic panel. Yeah. Okay. So one is going to look at bleeding, right? One is going to look at electrolytes. We're trying to determine what could be a causatory factor. That's what laboratory values do. If we are talking about a lesion due to H. pylori, we need to eradicate that. And H. pylori is very common. Actually, when I was in Kenya, I had to visit the doctor's office. I had to go to the clinic because I had abdominal pain, and the doctor had to investigate me. And I'm going to do a whole vlog about it, but he had to determine, I'm coming in with this stomach pain. I'm nauseated. I'm vomiting. He's like, are you pregnant? Could be malaria. Could be H. pylori, which is common. And I'm like, oh my goodness, none of these are good. I was like, pregnancy, malaria, I'll take the malaria. But then he said H. pylori. And I'm like, oof, I really don't want H. pylori, because look at the treatment for H. pylori. You have to get on antibiotics. Okay. You have to get medications to reduce gastric acidity. You might have to do a triple therapy with H. pylori. It is a very difficult medication. I could have had C. diff. Who knows, right? Or quadruple therapy, 3 antibiotics plus 1 antacid. So H. pylori is very, 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 very tough to have. Okay. And it'll cause lesions because it's just very virulent. All right. So if this peptic ulcer disease is not treated, what can happen? What can happen? And some of you know, we're talking about something that's pretty common: gastrointestinal hemorrhaging, ulcer perforation, gastric outlet obstruction. Yeah, gastric outlet obstruction. Okay. Whew. How do we prevent this? Prevention and prophylactic is the best, because when you have an ulcer, and I don't know if any of you've ever had ulcers, maybe nursing school gave you a stress ulcer, or someone said that when you lose somebody very important in your life, the stress of that can cause an ulcer. These ulcers can take a long time to heal. These ulcers can come and go. These ulcers may get worse when you eat, or they may feel better when you don't eat. And so prevention is better. Okay. Prevention is better than treatment. So avoiding or minimizing the use of NSAIDs, ibuprofen, over the counter, Aleve, ibuprofen, Advil, these things can be used for chronic pain, chronic inflammation. And so patients get very, it's not addicted, because I don't think it's addicted, but they get very comfortable taking these medications for the pain relief or the inflammation relief. And some of them are even encouraged to take them by their doctor. But we know that these medications can cause ulcers. Also, so changing in the lifestyle is preventative, meaning patients stop smoking, stop drinking. Preventive or prophylactic therapy is also a option for patients. Okay. So we are going into how we are looking at our patients who may have peptic ulcer disease. We are going to evaluate their pain, their risk for bleeding, their risk for perforation, and acid-base imbalance. Think about how acid-base imbalance plays into this scenario. And this is why I say NCLEX is about seeing the big picture. We cannot just focus in on one topic. And so the comprehensive review looks like 3 weeks of lecture, 1 to 2 weeks of questions. Okay. That is what it really takes. And as you can see, that's not a long process. One of the things we did to make the V2 even more accessible is we have completed the app. And I know we have over 1,000 people that have downloaded. It may even be more than that, but over 1,000 people downloaded the app within the first week. So check it out. If you have a V2 account, you now can access it on your phone with the app. I've been getting such a great feedback from it. We worked so hard on that app for you guys. All right. We worked so hard on that app for you. So just make sure that you're getting the great use of the program and you're doing it correctly. You're doing it correctly. Okay. How about NCLEX questions? How about some NCLEX questions on the subject? Let me see how you do. Here's the first question. Number 1. The nurse is assessing a client with suspected peptic ulcer disease. Stool test and breath test were ordered. The client was hesitant and asked the nurse the rationale for the workup. The nurse's best response would be, number 1, these tests will determine signs of bleeding. 2, these tests will check for presence of bacteria, which can cause the ulcers. 3, this will help us if you have anemia, which is caused by ulcers. Or 4, If these tests were unrevealing, then we'll proceed to endoscopy. Which one is it? 1, 2, or 4? Okay. The app is free. That's one of the great things about the app. The app is free. It's like, yeah, it's great. So if you already have V2, just download the app and log in. If you don't already have V2, then you can download the app and do the free trial. Okay. All right. I see some 1s and I see some 2s. The majority, though, have it right, picking 2. The reason why we're doing a breath test, the reason why we're doing a stool test is H. pylori infection. Okay. This is a common cause of peptic ulcer disease, and you can do a breath test and a stool test. Yeah. Okay. All right. How about this? Question number 2. One of the possible complications of peptic ulcer disease is gastro ulcer perforation. To monitor this, the nurse should assess: number 1, sudden severe epigastric pain; 2, fast bounding pulses; 3, increased bowel sounds; or 4, hemotachsia. What do you say? We are talking about, and I said this was one of the complications, gastrointestinal ulcer perforation. Oh, I'm so sleepy, y'all. It's 9 o'clock here in Ohio, but it feels so much later. I think it's like 4 a.m. in Kenya. This is where my body is. My mind is here, but I'm so tired. So all of you who will be coming to the U.S., watch me this week. Watch me this week. We literally been traveling for 2 days. I came right in here. It was Wednesday. I am packed. I DoorDash. And I said, I got to get on for Winning Wednesday. But I'm so tired. All right. Correct answer is sudden, severe epigastric pain. Did I have that right? Yes, sudden, severe epigastric pain. Okay. This is going to be out of here the most direct link to gastrointestinal ulcer perforation. Okay. All right. I'm moving on. Question number 3. Here it is. A client with peptic ulcer disease is taking antacids for symptom management. The nurse knows that if the client takes excessive antacids, it can lead to, number 1, metabolic acidosis; 2, metabolic alkalosis; 3, respiratory acidosis; or 4, okay, respiratory alkalosis. What do you say here? This is that acid-base balance. All right. Okay. Thank God for y'all today showing up. Imagine if I did this class, staying up for almost 2 days and did this class and only 10 people showed up. I'd be so discouraged. But look, over 900 people are here with me on this Wednesday from all over the world. That's what makes this worth it. How could I not be excited and happy to be here with you? No matter what time it is for us. The time doesn't matter. The goal, the grind, that's where we live. Okay. So correct answer is, and we'll do a question and answer in session after this. Okay. Metabolic alkalosis. Did you get that? Because antacids are a base product. And so we have, when we're taking antacids, we're ingesting base, a lot of it. We know it's not going to be a respiratory condition. So it was either metabolic alkalosis or metabolic acidosis. Okay. And so it is definitely going to be whatever you said, if you said 2. Yes. All right. Here's number 4. Okay, this is a scenario. So, a client diagnosed with a bleeding duodenal, sorry. A bleeding duodenal ulcer was vomiting blood several hours prior to hospital admission. The client suddenly developed epigastric pain with a rigid board-like abdomen. With these findings, what is the nurse's priority action? Number 1, notify the physician. 2, administer pain medication. 3, prepare to insert a nasogastric tube. Or 4, place client in a semi-Fowler's position. If you're passing NCLEX, you're going to want to have practice with these types of questions. Very complicated patients. We're looking at somebody here that's had a fast change. The client suddenly, okay? So when you see this, you're going to say, Winning Wednesday, the night before Halloween, it was a 2024. You might remember that day. You might remember today. Okay. All right. And you're going to put answer number 1. I'm just going to call the doctor. I'm going to call the doctor because it's beyond me at this point. And you got to know your limitations as a nurse. You have to know when it's time to fold them. And when patients get to a place where they need new medications, new diagnostic exams, listen, you got to be able to say call the doctor. Because if you're picking other things, then it looks like you don't know your scope of practice. So we're going to call the doctor for this one. Okay. All right. Do I have one more? Hey, I got one more. I literally thought I only have 4. Here's number 5. A client with a history of peptic ulcer disease arrives at the emergency department with complaints of dizziness, black tarry stools, and a heart rate of 120 beats per minute. Which of the following interventions should the nurse prioritize? Number 1, prepare to administer IV fluids as ordered. 2, instruct the client to avoid eating or drinking until further assessment. 3, obtain a sample of the client's stool for occult blood testing. Or 4, assess the client's blood pressure and pulse. This is a good one. You have here a great situation. You have here a changing patient, and you need to determine. I'll go back and look at the other ones as well. 1, 2, 3. 2, then 3. Okay, so this is what I told the classes in Kenya. And again, these are nurses that are trying to learn about the NCLEX. They have not taken anything like this before. One of the things that we have to understand about NCLEX questions is that it is not a matter of what's right or wrong. That those kind of questions are not even. The majority of the questions will not be asking you what is right or what is wrong. They will be asking you what? They will be asking you what is the priority, because you're going to have several right answers. So you have to be able to look at all the things you're going to do, but identify this one is the most important for the patient. This one is the priority that's essentially gonna help this person live the longest. And that's really how you have to place these. Like, what is gonna help my patient live in the next 5 minutes? And if you're thinking about it that way, it's gonna be number 1, prepare to administer IV fluid as ordered. You essentially have no further real need to assess the patient before understanding what's the problem. Because you get, and this is the thing about content, you get the assessment here. Patient is at the ER. Okay, so we know this is an acute situation. They have dizziness. What's causing dizziness in people? People have dizziness when their blood pressure drops, if they have a glucose problem, if they have a brain bleed, if their oxygen is low, right? Dizziness. That's a big deal. So, okay, I read that already. Black tarry stools. Up, here we go. I don't have to read no more. My patient has dizziness and black tarry stools. Black tarry stools means my patient has a what? They have a what? They have GI bleeding. That's fundamentals. That's fundamentals. Black tarry stools. When we go over normals of bowel movement and normals of stool, okay? So black tarry stools, peptic ulcer disease, heart rate of 120 beats per minute. My patient's crashing. They're crashing, some sort of shock. Okay. So what do I need to prioritize? Fluid volume. Fluid volume over anything else. Assess the client's blood pressure and pulse. That's important. But do I need another assessment? Right? Do I need another assessment right here? No. Do I need to know the client's blood pressure and pulse, or do I need to get ready for this IV fluid? Okay. So again, it's not a matter of right or wrong, but you have to understand that this is a test for what? New nurses with no experience. So if you're looking at these questions and you are saying to yourself, even for 1 minute, but we don't do it like this in the hospital, or I've been a nurse for 2 years, or I've been a nurse for 20 years. That don't matter. That's not even one of the questions. They don't even ask you that. Doesn't even matter. You have to be able to look at these questions. And that's right. Somebody said the pulse was already given. That's so true. So we don't need to assess it again. Even though assessment is one of the first steps in the nursing process, if you're given assessment findings in the question, and that's why we're always looking for the question, okay? We're always looking for the question, the answer in the question. We're looking at that question because if you're given assessment, don't do it again. Now, okay, so we know that it's number 1, okay? We already broke it down. I do want to go back and look at number 4 because somebody said, why this question was: a client diagnosed with bleeding duodenal ulcer was vomiting blood several hours prior to hospital admission. The client suddenly develops epigastric pain in a rigid board-like abdomen. Okay. With these findings, what is the nurse's priority action? Okay. And so the correct answer here was calling the doctor. And so I got some pushback here because the choices are notify the physician, administer pain medication, prepare to insert a nasogastric tube, and then also 4, place client in a semi-Fowler's position. So I think the question was, why isn't it number 4? And why? Yeah. So 2 questions. Correct answer was number 1, notify the physician. And the reason why this is the priority action is because of the assessment. Okay. So bleeding ulcer, okay, and they came vomiting blood several hours prior to admission. So that's the history of the patient. We know that they have a bleeding ulcer. Now, where we are in the scenario is that this place here, the client suddenly developed epigastric pain. Okay. So what are we thinking that is? Sudden development of epigastric pain is perforation. So right there already, this is bigger than me. All right. And it also gives us more details that the patient has a rigid board-like abdomen. So this is it. It's a new problem, and the descripting factors lets me know that there's nothing in my nursing process that is going to make this better. There's nothing that I can do in ADPI. So we need to notify the physician. This is not passing the buck. This is not that. And why do I know that? Because of the assessment findings. This is, we're identifying this to be an emergency. So yes, Florence, I love that name. Rigid board-like is always a medical emergency. So notify the physician. Yeah. Okay. So I want to make sure that that's clear. Again, when we're doing these questions, we're not looking for right. Especially what I've been leaning more into. I've been leaning more into priority because that's a universal weak point for all of us. Okay. So I've been doing more priority, which is looking at a lot of right answers and picking the one that is the priority for the scenario. And that's why we have to do so many of these types of questions, because it's not a one answer for all of them. You got to get good at going in and out of these case studies, these scenarios. That's what next gen NCLEX is. It's so advanced. It's so advanced. And I love it. And so, as you guys know, every Monday and every Wednesday, we're doing priority questions. I'm sick of it, but I know it's what you guys like. And I know it's what helps us to have a bigger picture understanding. So again, if you like these questions, V2 has them for you. Okay. Over 2,000 questions in the RN and PN. And right now, my welcome home discount is looking like Black Friday. So if you guys want to get into the V2, this is the time. You can get 3 months for the price of one. Okay. Or you can get started with my entire V2 system for as low as, what does it say there? Not 99, because it was 99, but 69. So I hope that helps you all, as I am happy to be back home. People ask, what am I getting? You are getting the V2 platform. This is just it on my tablet. So you'll be able to watch all of the lectures. The question bank is also here. Okay. So when you go to this icon up here, because sometimes people ask me, where's the question bank? The question bank is right there under courses. All right. Right above the file vault, but you can get that there. All right. You're also going to get this quick facts book that I am sending. Okay. That I'm sending to your home. This book is for memorization, and you know how big most nursing books are. So quick facts will come to your home, and it is just this really little booklet. Okay. And it is my book of question and answers in the front. So no paragraphs, no pictures, no long rationales, just straight to the point. And in the back, the very important pharmacology section. Pharmacology section is coming to you. If you already have this book and you don't need it and you just want the system and the questions, then I believe the discount is even lower, isn't it? It's even lower. So just when you check out, take this book out of your cart and you will be able to even get a lower discount, because there's no need of me sending you this book if you already have it. But I will say, where's my other book at? You're also going to just quickly get the downloaded version of this book. Okay. So you'll get a downloaded version, but if you want the physical Now is the time to get the physical version of this book, okay? And for me, I bind it for you. I print it out for you so you don't have to get it. And I'll just send you, if you add this book to your cart, I think this book is $30 for me to print it. I will just send you both at the same time, okay? And yes, this program is for RNs and PNs. And what you will love about it, okay? This is what you're going to love about it, is that when you do my lectures, you will notice. What are you doing? Okay. How do I get this? Let me refresh it. Let me just refresh it 1 second. One thing I love about being back in the US is my internet. Okay. You will see that my videos are not long. Okay. That's 14 minutes. That's 18 minutes. Pain, 7 minutes. All right. And I do from pregnancy, okay, all the way to my last topic. I've been saying this, priority, okay, priority. So these are the subjects. When I talk about core content, I'm the content person, okay? I'm the content review. That's what makes me different. We can go into the questions, that's great, but content. All right. Okay, let's do question and answer, okay? Just a couple minutes for question and answer. Thank you so much. Get some rest. Enjoy the rest of the week. I know I'm there. Trust me, I'm on my way. When I go to sleep in like a couple minutes, I won't wake up. I'll just be sleeping all the way until tomorrow. What if you have the quick facts? If you have the quick facts, okay, let me show you what to do. Hold on. Let me see if I can do this in real time, because I saw somebody say, can you just show me how to order the videos? I don't know if I can show you. I'm gonna try. Okay, so imagine you go to remarnurse.com, and in the yellow box, it'll say NCLEX R and NCLEX PN review, okay? So just say you're NCLEX RN. I'm going to try to just show you how to do the video. I don't know if this is going to work. All right, get NCLEX V2. The prices are here, okay? The prices are here. So say you want to do the 69 for 1 month. That means you have 30 days in my course. The lectures, the question bank, the quick facts, okay? The downloadable workbook, all of that, 30 days. It tell you after the 30 days, it will auto renew, because this is a subscription to the V2 platform. It will auto renew for $50 per month. 2 things is very important for you in the beginning to really think about, how much time do I really need? Can I do it in 30 days? Am I going to be able to study? Do I have a test date? Or should I just get the 3-month course? Okay. And this is 3 months for $99. Pick the right one, because it makes such a difference. It makes such a difference. Okay. So let's just say you want to do the 69. You're going to do 30 days. You're going to be serious, in and out, 3 weeks content, 1 week questions. It's fast, but it's possible. So you go to join now. Okay. Join now. And what's going to happen is, it's going to say you already have an account. Let me try to open up an incognito, because I already have an account. So it's just auto logging me in. I'm not the best at this. I don't know if I can open up an incognito account right now. Hold on. I think I did it. Private tab. Okay, let me try it again. Let me try it again with a private tab. Then it won't know me. remarnurse.com. Live video. Let me try it again. Okay, we're going to start from the beginning in a private tab. So I'm going to go to RN. I'm going to get NCLEX V2. I'm going to do the $69 one. It's a button here. Okay. Yes, I have case studies in QBank. I have everything in the QBank, like case studies and bow tie questions, everything. So over here is where we're going to focus on. Okay. So when you sign up, it will give you some suggestions of like what you might like to buy, but then it'll give you your order summary. So right here, we have 1 month for $59, plus the quick facts book is $10, which makes it $69. If you already have If you already have quick facts and you don't need this book, boom. Okay. Take it out. And then you have $59. Okay. $59 for 30 days. Now, also, don't forget, you can even, when you sign up for everything, you'll be able to even delay your start date. So even if you don't want to start now, you want to start later, you'll be able to do that. Okay. But this is how you get just the lectures and just the question bank. Okay. Okay. All right. So that's it. So, question. So I need to buy the V2 workbook and quick facts. Yes, that's considered my entire program. I know some people, they'll message me and they'll say, "Hey, Professor Regina, I failed with REMAR." One of the first questions that I ask is, did you do all of REMAR or did you just do quick facts? Because of TikTok and YouTube, there are so many people that just buy quick facts and they say, "I'm doing REMAR." That quick facts, I love this book, but this book was never a complete program. Why? Why is this book never a complete program? Because there's a whole nother part. And the stuff in here is not in quick facts. And the stuff in here is not in here. So there are some things that you cannot just read and understand. I mean, some people could, but most people don't. Prioritization is one of them. That's why prioritization is in here. Acid-base imbalances is in here. Okay, so there are many disadvantages to not doing the entire program. So yes, you're doing the lectures. Where is it at? You're doing the lectures in the V2, which is the platform. You're doing the lectures there, and you're watching. Okay, so while you're watching these videos, okay, I'm not doing any case studies tonight. There's case studies in the question bank, but there's no way. I'm not even prepared to do it. I'm so tired. While you're watching these videos, you're filling out this workbook. Okay. And it's best to have the workbook printed out, because when you look at what's inside of the workbook, a lot of the information is already pre-printed for you. So you don't have to write out everything. But if you're just using a blank workbook and you're writing out everything that I'm saying, it's going to take you a lot longer. So certainly if you're doing the 30-day, make sure you get the workbook. Make sure you get the workbook. And let me try to go back to where I was. If you want to add that physical workbook, like maybe you don't need questions. If you want to add the physical workbook that I just showed, just add it. Okay. Okay. So thank you, Professor, for more explanation on V2 lecture videos. Yes. Okay. I have still work while studying. Yes, it's true. And this is one of, if you have a job, and you know that you have bills to pay, and you know that you have, to work and take care of your kids, it's going to take you a lot longer to study unless you have a test date. If you have a test date already coming up and it's in November, do the 30 days, because I feel like that will force you to really study. Okay. Yeah, okay. So any personal questions, like about your account, changing your password, changing your email, please just send me an email, support@remarreview.com, and I will assist you. This is also if you have questions about tracking, things like that. If you are in Africa already, don't purchase it on my website. Let me connect you to our partners, Kenyan Nurse Consultants, who have the books in Africa. They can get you in their system. It's much easier because the books are already in Africa. If you choose to buy them from the US, then they have to go through customs. It takes a little bit longer for you to get them that way. I listen to V2 in my car. Yeah, I do too. All right. Okay. I'm so nervous. for my third attempt, Professor, I have high hopes with your program. Well, Jen, I hope you were able to see some of the nurses that came on today, because most of them that came on for tonight actually said they took NCLEX more times than you. So we had 2 people that said they took NCLEX 5 times and they were able to pass it. How many pages is in the workbook? I do believe it's over 100. Okay, let me see. So with this physical workbook, it's 122. However, with the one that is printed out, I think it's maybe only 101. The physical workbook has a bonus section, clinical judgment activity book. So that's one of the benefits of this book. All right. Yeah. If you've taken the test 13 times, again, like I said, that doesn't bother me too much as long as we're able to assess what you're going to do differently the next time. Okay. After 20 years, is it possible? Absolutely. Absolutely. I want to do the LPN. Which workbook can I buy? This workbook is going to be for both RN and PN. So just get this one. Hi, Professor. I just graduated from LPN school. Do yourself a favor. If you graduated from LPN school, take an NCLEX review, because the NCLEX is very comprehensive and your program might have been very specific. I don't know what NCLEX prep you did in your LPN school, but you can tell me and I'll try to answer you. Okay, so I need to download the workbook and print it out. Yes, if you don't have the physical workbook coming to you and you just get let me see if I can show you. If you don't have the physical workbook and you just have the downloadable one, what you're going to do is you are going to come into, when you open up your V2, you are going to go to the third panel here, and it says File Vault, okay? And you're going to click on File Vault. And in your File Vault, you will be able to get the 30-day calendar, and you will also be able to get, and I think it's books, it might say books and certificates or something like that on your platform. You'll be able to get the workbook there and print it out right there. You have to have a PDF reader though, because it's a PDF. Is the QBank different? The QBank is different. The QBank is here. So you'll see QBank. You'll go to QBank and press it, and you'll begin to create a test. It'll show your test history. So where it says create a test. Hold on one second. Go to create a test, and you'll be able to create a dynamic test, meaning you'll be able to do tutor mode. You got to name it. The difficulty level is there as well. And then you can also do subjects. So if you want to just do case studies or next gen items, again, this is a full system. This is studying everything in one place. So, all right. How do I get the V2 book in the US? I need a little help with case studies. Okay, so I will try to do case studies on another live. It usually takes, if you're in the US, it usually takes 3 to 5 days to get the books. We try to ship them out next day, except for on the weekends though. So like on Friday, Saturday, Sunday, the office is not open. So all those books that are paid for on Friday, they will get shipped out on Monday. Okay. All right. So let me know if you're having something specific. If you're having something specific with V2 or about V2, I'd love to answer it, but it just will take for me to probably go into your account or somebody from your team to go into account. So let me do that via email. Okay. I got it within 3 days. Okay. Hi, Professor Regina. I just wanted to ask about the V2 CAT. Is it a good way to see where you're content-wise, or is it just like the other tests? No, it's not like the other tests at all. You had 2 CAT exams with your subscription. That is a final preparation for your actual NCLEX. So the first one you take to see where you are. If you pass it, great. If you don't pass it, great. You get to look at the areas that you're weak on. You get to determine, okay, how did I feel during this 5-hour exam? Because with my CAT exam, you're not able to skip or omit any questions. So you literally have to sit there and try to do your best. It's mental work. The CAT exam is more mental work, and to help you really get into that mentality for passing the NCLEX. So that's why you need to do that. All right. You can also, if you just want the textbook, the V2 workbook, you can go to remarnurse.com, and then you can also go to physical books. All right, everyone. Okay, I'm going to wrap this up here. It's been an hour studying with you all. I try to keep our Winning Wednesdays a little bit shorter than that, but hey, we had a lot of things to discuss. And so now we are going to close out this Winning Wednesday and prepare for an amazing weekend. Again, we're doing the sale. I do want you to take advantage of it. If you don't have V2, this is a perfect opportunity to get it, because literally some of y'all will be starting it for just $59 or $69. That's more than enough. All right. And then also you're going to get physical books. You're going to get the Quick Facts book if you don't have it, plus the digital downloaded book, plus the 30-day calendar, plus 2 computer adaptive exams, all the question banks, the content as well. So I want to be a blessing. I'm happy to be home. We are going to pick up right where we left off, because we are going into the month of goodness. We're going into the month of November. So let's just strap in, get ready for this ride. It's going to be a great one. And as always, you can, you will, and you must pass NCLEX. Get some rest, everybody. Bye-bye.